Hi, my name is Stephanie Murdoch. I'm a registered nurse and a childbirth educator, and this is my childbirth education course. First of all, congratulations on your pregnancy. I'm so excited for you, and I'm excited that you're here taking this course. This is a condensed childbirth education course. So what I mean by that is we have looked at the curriculum and taken all of the most important information and condensed it down into a 4-week course. I wanted to create something that you could do from anywhere at any time that was easily accessible. I know in our busy lives in this day and age, it's really hard to commit to a full day, a full Saturday of class, or commit to an 8-week class. And so I wanted to make something that would work with your lifestyle a little bit better. I've looked over this curriculum with my mom, Julie Aiken. She will introduce herself later on in this course. She actually teaches weeks 2 and 4, but she has her PhD. She's a registered nurse herself, and she worked for years in labor and delivery. She's taught childbirth education classes herself, and so she is just a wealth of information, and her experience is truly invaluable to this course. Like I said, this is a 4-week course. I wanted to give you guys an idea of what you have to look forward to in each week. In week 1, we talk about the anatomy and physiology of pregnancy and your developing fetus. We talk about exercise and nutrition in pregnancy, and then we talk about when to go to the hospital and, of course, what to bring. In week 2, we talk about the stages of labor. Week 3, we get into assisted deliveries, so we talk about C-section, epidurals, forceps, and then in week 4, of course, we talk about the best part, which is delivery of your baby, meeting your baby for the first time, the first feeding, and then some things of what to expect during that postpartum period. I'm really excited about this course. I know you guys are gonna love it. Let's get started into week 1. Welcome to our childbirth education course. My name is Stephanie Murdoch. I'm going to be teaching week 1 and week 3 of this course, and then Julie Aiken, that's actually my mom, is going to be teaching weeks 2 and 4. She has over 20 years of experience as a labor and delivery nurse, plus she has her PhD. She is an educator, a nurse educator. She used to teach childbirth education courses herself, so I thought it would just be super fun and a good perspective to have her teach part of this course too. So let's just get started. Alright, so as you can see, week 1, these are the things we're going to be going over. The anatomy and physiology of pregnancy and developing fetus, common discomforts in pregnancy, nutrition, diet and exercise in pregnancy, warning signs, and then what to bring to the hospital. Alright, so anatomy and physiology of the 3rd trimester. I want to just start off with this graphic that shows a side-by-side comparison of what a pre-pregnancy body looks like next to a woman pregnant in her 3rd trimester. As you can see, the organs have all shifted to make room for baby, so you can imagine the physical discomforts that this will inevitably bring about. In the next slide, we're going to talk about common discomforts of pregnancy, and besides your own personal experience, have a great picture to show your support person when you're having an off day and maybe they don't really understand. Show them this picture and say, "Look what this baby's doing to my body." Common discomforts of pregnancy. Number 1, we've got relaxation of pelvic joints. The relaxation of your joints prepares your body for birth, which can cause backaches. Your center of gravity is also changing as your baby and uterus continue to grow, which can also contribute to aches. Again, particularly in the lower back. So feel free to use heat on your lower back to help ease this pain, and put your feet up when you can. High levels of progesterone and pressure from your growing uterus may also cause indigestion, constipation, heartburn, varicose veins in your legs, hemorrhoids, or swollen ankles. So be sure to drink enough water, get about 30 minutes of exercise daily, and eat enough fiber in your diet to help decrease the risk of constipation and hemorrhoids. We're going to go into detail about nutrition and exercise in pregnancy a little bit later. Most providers approve Tums for indigestion. Just be sure to follow their recommendations. The best thing to do for swollen ankles is to give your feet a rest, like I mentioned. The increased progesterone can also contribute to bleeding gums and nosebleeds. That's kind of a different side effect of the progesterone that most people don't know about. So you just want to be extra gentle when you're flossing and brushing your teeth. With the expansion of your uterus, you might experience shortness of breath or sore lower ribs. I remember my husband and I would read out loud to each other in my 3rd trimester of pregnancy, and we would both just giggle because I would get out of breath just reading out loud. About 2 weeks before the birth of your baby will actually drop into your pelvic cavity. This is called engagement or lightening, and you might be able to breathe easier once this has occurred. So you can look forward to that. The trade-off, however, is as the baby's head presses on your bladder, you can imagine that you need to urinate more frequently, kind of similar to that 1st trimester. With my first pregnancy, my husband and I were lucky enough to take a trip to New York. That was considered our baby moon, and he always jokes that I saw more of New York than the average person because of all the bathroom breaks I had to take. One of the curses of pregnancy, but I'm grateful to have had that problem and have been able to have a healthy pregnancy. All right, so let's move on to the 3rd trimester fetus. This is kind of fun. Since we've talked about the anatomy and physiology of mama in the 3rd trimester, we get to now talk about the anatomy and physiology of baby. And I'm not going to go super into this because I know you guys probably all use those fun apps that go week by week and tell you what is happening with baby each week. But we'll do a brief rundown of that 3rd trimester. So as you can tell from the photo, the 3rd trimester is a period of growth and especially weight gain for your baby. During the last 4 weeks of pregnancy, your baby can gain around 1 pound of weight per week. And we're going to welcome all that extra weight. We want them to be chunky and have those rolls. In late pregnancy, your baby's lungs mature, which means they will produce something called surfactant, and your antibodies pass through the placenta to your baby, which provides some short-term protection from the diseases to which you yourself are immune. Now, by the beginning of the 3rd trimester, you should definitely be able to feel your baby move. Some of those movements actually might even hurt. And towards the end of pregnancy, as your baby continues to grow and gain weight, they'll have less room to move around, and you might just feel slight jabs of the arms and legs move rather than the whole body doing the wave or somersaults. You'll want to talk to your provider about how often or even if they suggest for you to monitor your baby's movement. That can cause anxiety for some moms, so be close with your provider and ask them, what they suggest. The American College of Obstetricians and Gynecologists recommends monitoring how long it takes for you to feel 10 movements. So you should feel about 10 movements within 2 hours. If you don't feel any movement at all for an hour, we suggest that you drink a glass of cold water, orange juice, eat something like a graham cracker, and lay down, and keep monitoring for movement for the next 30 minutes. Always call your provider if you have any concerns. At some point during the 3rd trimester, your baby will assume a favorite position, hopefully head down, and we're going to talk about breech babies when we get further into the course in week 3. Okay, nutrition and pregnancy. You're going to want to eat a variety of foods to promote a healthy pregnancy. It's important to eat foods from all different sources to make sure that you get all the vitamins, minerals, and nutrients to promote that healthy pregnancy. It will also contribute to your baby's healthy growth and development. So you're going to want to choose whole grains, high in complex carbohydrates, and aim for 7 to 8 servings daily. Choose 7 to 8 servings of fruit and vegetables daily that are thoroughly washed. Aim for 2 to 3 daily servings, or approximately 60 grams of lean protein sources such as chicken, fish, and legumes. That's beans. And then avoid raw fish, so sushi, swordfish, mackerel, and limit tuna fish to 1 serving per month due to the high potential levels of mercury. Consume 3 to 4 servings of milk products daily. Avoid saturated fats, animal fats, and choose healthy fats such as olive oil or canola oil. A great resource that you can check out is choosemyplate.gov. I have that on there. And they have the latest guidelines on a safe pregnancy diet from the USDA. You're going to need a few extra calories a day to stay healthy and help your baby grow. So a good rule of thumb is 3 meals and 3 small healthy snacks per day that are a combination of vegetables, fruits, carbs, and protein. Take a daily multivitamin with 0.4 milligrams of folic acid, which is needed to reduce neural tube defects, which are birth defects of the spine and brain. So either take a multivitamin that includes that or a prenatal vitamin that your provider suggests. Weight gain, everyone's favorite topic. So weight gain should be based on your pre-pregnancy weight and height. However, a good rule of thumb for just a normal weight woman is 25 to 35 pounds. Your healthcare provider may have specific recommendations based on your medical history and lifestyle. And then if you're carrying multiples, your calorie intake and weight gain should increase according to the number of babies. I'll let you guys read this on your own. So these are just things that we should avoid, pregnant women should avoid. The main reason that we avoid these things is they can just be hostile to the baby. And of course, discuss any of your questions about nutrition questions with your healthcare provider, because every provider has a different view on what's okay and what's not okay for a pregnant woman to consume. These are just the recommendations.